So I would start this procedure by assessing the patient, assessing their overall condition, if they're able to cooperate during the procedure, if they're able to remain supine and like hold still during the procedure. And then I can get another nurse to help me if needed. I would also assess the last time the patient voided or had a catheter. I would then assemble my supplies. So I have my catheter kit here. I would perform hand hygiene. I would introduce myself to the patient. So my name is Emily Kestel and I'm going to be your student nurse. I would explain to them what I was doing. So I'm going to insert an indwelling catheter into your bladder to relieve it. I would also have the patient state their name and date of birth, looking at their wristband and verifying that. I would also verify their allergies. Then I would assess the patient. So I would feel the bladder for distension and fullness, just making sure they do indeed need this procedure. I would also raise the bed to waist level, making sure it's at a good working height, making sure they are laying supine in the correct position, and then making sure so I'm doing a female catheter, I would need to put them in the right position for this procedure. So I would have them laying flat, flexing their knees and their legs 2 feet apart, and then making sure that their hips are externally rotated so I can do this procedure. So now I'll open the kit. So I would open the kit away from me so that I don't contaminate. Okay, I would put the pad underneath the patient's I would lift, and I could get help if I needed it, but I would lift their bottom half up and put it underneath their butt for this procedure. And then I would be sure not to touch the center of this pad so that I don't contaminate it. And I would be sure not to lean over my sterile field. Okay, so now I would need to put on my sterile gloves. Making sure not to contaminate them. So now I just need to get everything ready. I would make sure that I would have my trash can nearby. So I don't need this. I would put that, discard it in the trash can. So I need to get all my supplies ready. So I would open my iodine solution. I would put that on my cotton balls. So I'd pour it on there. Discard that. I would then open my lubricant. I would put it in the kit and I would discard that. Then I would get the catheter out. I would remove this cover from it. Discard that. And then I would stick this end in the lubricant. Making sure not to contaminate. Set that to the side. Put in attach the syringe. So take the top off. Discard that. Attach it to the tube. So I would make sure that this end doesn't touch anything because it would then contaminate it and I would need a new one. So being very careful of that. I would attach the syringe to the tube, put that in the lubricant and let it sit. So now I can begin cleaning. So I will take my forceps. I would also have done perineal care beforehand. So now I will be using the iodine. And I will use my non-dominant hand to open the labia. So now I can't move this hand because it has already touched and it would be contaminated. So now I will begin cleaning. I will go in a circular motion like that. I will discard this. I'll get a new one. Do the other side. And then I'll discard that. Another one. Straight down. Discard that. And then a fourth one as needed. Making sure that it is clean, and then I won't need these anymore, so I discard those. So next, I need to insert the catheter. So I'll take the non-contaminated end. After it is lubricated, I'll explain to the patient, or I'll ask them to take a deep breath in, and as they're exhaling, I will insert the catheter. So I'll insert it into the urethra. For a male, you have to go in further than a female, but I will insert it until I see urine return. And then once I see that, I will inflate the balloon. So if the patient was having any discomfort or pain, I would take out the catheter and I would have to assess that. But I will inflate the balloon. And then I will the syringe. And I will be sure to test that the balloon was in the bladder. I'll give a little tug to make sure it doesn't come out, to make sure it's secure. Next, I would secure the tube. I would tape it to the patient's inner thigh, and then for the bag, I would connect it to a lower part of the bed that was non-movable. Connect it there. Then I would discard my gloves. I'd also assess the patient, making sure that they're comfortable, making sure it doesn't hurt. Then I would document, I do hand hygiene. I would also document what I did. So I inserted a indwelling catheter, how the procedure went. I would document the size of the catheter, also how much volume of urine was released, also the color and the color of the urine and the odor.